Another study, the British Medical Journal, they warned that cortisone may accelerate cartilage loss, especially when administered repeatedly over time. You see, there's a reason why you're only supposed to get 3 cortisone injections in a joint per year, because that cortisone breaks down and weakens that tissue. If the joint wasn't aligned properly, if the weight wasn't evenly distributed over the joint because of the poor mechanics or alignment, this only speeds up the degeneration process. Welcome back to the Freedom Health Show. I am Dr. Matt Gianforte, and I am here to help you rethink your health, to get to the root cause and not just manage your symptoms. You know, in our last episode, if you didn't catch it, we talked about how joint pain, especially knee pain, has become an epidemic in the U.S. and how too many people ignore the early signs until the pain becomes debilitating. Today, we're going to take a hard look at what happens next. What most people go through once joint pain starts in. It's very, very predictable. It really goes in 4 steps. First step, people have a little joint pain. They go to their medicine cabinet and they get an over-the-counter medication, ibuprofen, Advil, just to take the pain away, right? Next step, pain gets a little worse, so they go to their doctor. It's a prescription anti-inflammatory or painkiller. Or maybe they get a cortisone injection. Again, those are just masking the problems, which leads them into step 4. Now you've got a torn meniscus. Now they need to go in and clean up the knee a little bit, right? So step 3 is that surgery. After step 3, because that joint has been weakened and exposed and to a surgery over time, because you never corrected the problem to begin with, it's rinse and repeat, right? You get a little bit more anti-inflammatories, you get a little bit more cortisone when it hurts again, but then that joint breaks down further and it's right back to surgery, eventually leading to that joint replacement, leading to that knee replacement, that hip replacement, that disc surgery, because you were never properly taking care of your joints and getting to the root cause to begin with. And while this is a standard medical approach, research is now showing us that this model, it's not effective, and it's actually harmful for the joints, and it's no wonder why we have so many people with arthritis in our country. So let's break this down together so you can really understand. You see, the first stop for most people is just dealing with the joint pain, and this is in the medicine cabinet with like NSAIDs, ibuprofen, naproxen. These are often just touted as pain relievers, no big deal, gonna take these to feel better, right? Like they don't cause any damage to your body at all. They're everyday solutions. But regular use comes at a cost. And according to a 2015 study published by Therapeutics and Clinical Risk Management, long-term NSAID use is associated with gastrointestinal bleeding, cardiovascular events, kidney damage, delayed tissue healing, especially over the age of 50. And when are most people having their joint pain? Over the age of 50, because they've got 50 years of wear and tear on their joints and it's finally catching up with them. The majority of our patients here at the office with joint pain are over 50. Their joints have broken down over time. And here's the problem. These drugs, they don't do anything to correct the underlying mechanical, biomechanical causes of the joint pain. They simply block the pain. It's like muting a fire alarm while your house is on fire and still burning. You know, people often report they feel better, so they stay active, but the joint continues to break down. Hey, I remember when I was young, I injured my ankles, and the whole goal was just to get me back playing as quickly as possible. So I'm icing, I've got TENS units on my ankles, I'm getting out of pain in 4 or 5 days, but all of the research shows that you're not going to heal that tissue in 4 to 5 days, right? And then I would strap on an ankle brace as tight as I could, or I would tape it up and I'd go play again. Well, this damage when I was young and not properly taking care of it has led to having chronic ankle pain and sometimes knee pain for myself, where I have to do so much more now in order to maintain my joints and my ankles, from foot supports to making sure my knees are adjusted and properly aligned to help to prevent and reduce that wear and tear. And the inflammation, when you do have it, it may be temporarily reduced when you take these anti-inflammatories, but the movement dysfunction, it remains. And this damage continues to accelerate. But it's a silent degeneration, okay? It's slowly. You don't even know what's going on until you get into your 40s and 50s, and the simple things become a lot more difficult. And once that NSAID stops working, the side effects become much more. The patient turns to their doctors. They're looking for something stronger and stronger because that small NSAID that was taking away the pain and inflammation doesn't work anymore. And the reason why it doesn't work is not that your body's getting used to it, it's that the damage is getting worse. So when the pain persists, you go to your doctor, next solution is cortisone. And corticosteroids are injections widely used and often promised as a fast and powerful relief, right? And it's true. They can reduce that inflammation quickly. But at what cost? 2019 study published in Radiology found that intra-articular cortisone injections were associated with rapidly progressive arthritis, subchondral fractures, and joint collapse. Even in patients who initially responded well to the treatment, another study, the British Medical Journal, they warned that cortisone may accelerate cartilage loss, especially when administered repeatedly over time. You see, there's a reason why you're only supposed to get 3 cortisone injections in a joint per year, because that cortisone breaks down and weakens that tissue. So these aren't minor side effects. This is permanent structural changes that are now happening to your joint. So what's happening is the cortisone reduces the inflammation and decreases the pain. But because pain is that protective mechanism, patients go back to full activity without realizing the joint is still unstable. And this leads to greater stress on the cartilage and connective tissue. And if the joint wasn't being loaded properly to begin with, meaning this, if the joint wasn't aligned properly, if the weight wasn't evenly distributed over the joint because of the poor mechanics or alignment, this only speeds up the degeneration process. In fact, some of you guys have probably been to a doctor and had x-rays done before, and you see one side of the joint is more degenerated than the other side of the joint. This is simply a mechanical issue that's going on with your body, and you're wearing one side more than the other. It's no different than the tires on your car, where you wear one side of the tire more than the other, depending on which way you turn more and if there's alignments and balance issues and so on, right? So here's what I tell my patient. Cortisone is like cutting the wire to your check engine light. It might stop the blinking, but the engine's still breaking down. Eventually, the damage is going to be too great. The joint becomes unstable or painful again, and now the MRI shows, oh, you have a meniscus tear, cartilage loss, or the bone-on-bone arthritis. So what's your next step? Well, it's that third one that I talk about. It's surgery. Once that joint becomes visibly damaged on imaging, surgery often feels like the only options. And some patients, especially those with traumatic injuries, it may be, right? But for the vast majority of people, surgery isn't the fix. It's just another phase of the symptom management cycle, that joint pain cycle that I'm talking about, where it starts with the pain, goes to the cortisone, goes to the surgery. But guess what? It's like a merry-go-round. So every time that merry-go-round goes around, you're right back at taking more anti-inflammatories, more cortisone, more surgery, until it breaks down and you need a knee replacement. So when we talk about arthroscopic knee surgery, for years, surgeons performed cleanup procedures, shaving cartilage, removing torn meniscus, with the idea it would reduce pain and improve function, right? Well, in 2017, the British Medical Journal concluded that arthroscopic surgeries for degenerative knee disease provides little to no long-term benefit over physical therapy alone. And it comes with a much greater risk of complications. Removing parts of the meniscus or cartilage doesn't address why the tissue is wearing down in the first place. And maybe you have to have that removed, but it's very critical that you're getting the mechanics corrected so you don't continue to wear that down at the same rate as you were before. You see, once that cushioning is gone, that joint degeneration accelerates, and then what's your next step? So then your next stop, total knee replacement. It's estimated that nearly 800,000 total knee replacements are performed every year in the United States. And that number is increasing rapidly. But here's what is rarely discussed. There was a study done out of Lancet Rheumatology that shows that up to 20% of the patients report ongoing pain after a total knee replacement. And many are dissatisfied with the mobility or the function even after surgery. Why? Because the mechanics, again, were never corrected to begin with. See, the joint may be replaced, but the faulty movement patterns, weak muscles, and poor biomechanics, they're still there. And in order to break this, you have to get back to correcting the root cause of the problem. So when we take a step back and we look at the traditional treatment model for knee pain, it's suppress the pain with medication, numb inflammation with cortisone, cut or replace damaged tissue with surgery. But in almost every step, it fails to ask the most important question, is what is the cause of the damage in the first place? Now, if it was a traumatic injury, makes sense. Maybe you have to have that surgery, right? However, that's not the case most of the time. And most of the time, it's a mechanical issue that's going on, okay? Again, think of the tires on your car. If those tires aren't aligned properly, you're gonna wear that tissue down. Well, our body is put in positions that it's not used to throughout our lifetime, okay? We sit more now than we ever have before. Sitting, our body wasn't designed to do that as much as we are today. This causes an imbalance in the muscles. And this imbalance in the muscles causes pulling on the bones differently, which is causing that wear and tear that we see so commonly in people here at our office. So that's what we ask here at our office at LIfeWorks is, where did this all start? We start by looking at the mechanics of the body, how you move, how your joints are aligned, how your muscles are engaged. We assess the gait, the posture, the movement patterns, all to identify where the dysfunction really begins. We also look at therapies that are going to help support regenerative processes and recovery in your body instead of just masking the pain. You see, chiropractic care, physical therapy, myofascial release, these are amazing in order to help to correct the mechanics. But once that joint has already worn down and that wear and tear is happening, this is where regenerative medicine and the new advances in technologies and healing when it comes to joints is now available. And when we treat the cause, the body has the capacity to heal it without rushing into surgery or relying on medication and damaging the joint even more. So in the next episode, we're going to dive more into the biomechanics of the knee, how faulty movement patterns create chronic stress on the joint, and what you can do to restore that healthy function and avoid further breakdown. And then we're also going to talk about the amazing benefits of regenerative medicine and what people are seeing today with regenerative medicine, getting their life back without surgery, without drugs, and being able to manage their condition better. So if you're ready to stop managing the pain and start solving the problem, visit us at LifeWorksKC.com. Reach out. We'll see what we can do to help. We're on Spotify and we're on Apple Podcasts, so you can see us on either one. Subscribe to those so you don't miss an episode of the Freedom Health Show and helping you to achieve your optimum health.